Hi, in week 5 we're looking at quantitative research. Quantitative research traditionally begins with a standpoint or a theory. It often presents a hypothesis to be tested. The purpose of quantitative research is both to provide measurements, as in how much, how often, how many, and so on, and to define a relationship between variables, which can be either dependent or independent variables or extraneous. Traditionally, quantitative research is seen as the most value-free or pure form of research. It is deductive in form, in the sense that it is concerned with testing ideas or concepts, and that's opposed to the inductive nature of qualitative research. The primary tool is a structured questionnaire administered to respondents, but other forms of research can also be structured observation. A quantitative survey is a structured way of measuring a set of values or data which can be analysed statistically. So start by developing a general purpose statement, and we give this example. Access to health services is not equally universal. Some people or social groups have poorer access to health services in comparison with the general population. Which groups are they and why? Then think about the most appropriate sample and questions to ask that will give you the clearest, most reliable and most actionable responses to this research objective. Questions must be value-free, not leading the response. Developing a methodology. Research design is primarily based on the survey question or objectives being pursued. The nature of the prospective research participants is very important in terms of how they fit with the topic of the survey. That will influence the method chosen. For example, if it is concerned with aged care, we may wish to speak to older people who use aged care services, as well as to the adult children of those people or to the carers of older people. We might also consider speaking to the providers of aged care services or people who work in the aged care industry. So give it some thought. We also need to consider how we go about contacting these people, whether they are readily contactable, whether they're likely to respond to an online survey, whether they have telephone connections, are they known or not known to have particular special needs, such as hearing, eyesight, language or other differences. That will all impact on the method chosen. Survey sampling is also dependent upon the types of questions being posed, and whether these perhaps may require prompt materials, such as photographs, models, samples, or other materials, and also whether the questions are likely to be of a very personal nature. Thus, it is in the nature of both the survey questions and the survey respondents that the best methodology presents itself. Various types of sampling are used, including probability and non-probability sampling, and these include purposive and quota-controlled, convenience and random sampling. Have a look at this week's study notes for more detail. Quantitative research has a number of methodologies at its disposal, and these include telephone, face-to-face, online surveys, mail-out, mail-back, self-completion, interviewer-administered, intercept interviews, accompanied or unaccompanied or mystery visiting or shopping, and many others. As stated, the key to designing an effective quantitative survey does lie principally in the overarching and subsidiary research questions, and we must remember that at all times. Quite often these are developed with the benefit of some exploratory qualitative research prior to developing the quantitative study. It can also be based on a working understanding of the status quo in a particular field. Writing a survey questionnaire is quite simple, so long as you present the questions in a logical and unambiguous form. In quantitative research, questions most often take the form of when, where, how often, how many, why not. Pre-coded responses should be ordinal. Now, what do I mean by that? In this little chart here, the question is, how often do you visit your local community health centre? And on the left-hand side, we've got the responses with the pre-codes. Sometimes 1, occasionally 2, never, 3, from time to time, 4, I don't know, 5, just when I am sick. 6. So wrong. Why is that wrong? I think it's pretty easy to see. For example, sometimes and occasionally basically mean the same thing, as does from time to time. And just when I'm sick is pretty much meaningless in interpreting the results. And it's not presented in an ordinal fashion. That is, it doesn't go from least often to most often or vice versa. In contrast, on the right-hand side, we see the responses often a few times a week, 1, sometimes a few times a month, 2, occasionally a few times a year, 3, seldom once or twice a year, 4, less often than once a year, 5, and never, 6. You guessed it, that's right. That's the correct way because it's ordinal. You must pre-test your questionnaire. In this example here, the person is being asked something about km/h, and he's got no idea what is meant by km/h. Quite simply, you need to state 30 km/h and then explain what it means, kilometres per hour. Avoid technical words that members of the public may be unfamiliar with, and if you must use them, explain what they mean. And this also applies to a potential health survey that we're talking about this week. Don't use medical terminology when you're researching a non-medical audience. This graphic here is courtesy of the Universal Design Public Service Toolkit, and I've given the link there to the website. It provides some excellent information on how to present information to the public in very simple terms so that everybody will be able to understand what you're trying to say. Coding. Once all of the questionnaires have been completed, the data is cleaned. That means we go through all of the questionnaires to make sure the questions have all been asked and answered and marked appropriately, and then any open-ended questions are coded. Coding means grouping together sets of responses that link a central thought. For example, these are responses, potential responses to a question, which could include it's embarrassing, makes me uncomfortable, I feel ashamed, it's too personal. They all describe a similar attribute or feeling, so they can be linked together under the one overarching code for data analysis purposes. And in this case, we could call that code too personal, intrusive. Once a set of relevant codes has been identified, these can be numbered from 01 to 99 and applied to the open-ended responses in a questionnaire to enable statistical analysis of frequency and distribution. This week we're doing something different. We're having an ideas forum. Click on the forum icon in Moodle and write in what you think may be insightful and appropriate questions to include in a questionnaire on the subject of user satisfaction with a public hospital outpatient service. For example, users may be asked a question like this. Do you feel the medical and ancillary staff at XX Hospital really listen to you when you come in for a consultation? The pre-coded responses could be yes, no, don't know. Alternatively, you could think about rewording that question, and ask, how well do the medical and ancillary staff at the hospital listen to you when you come in for a consultation? And the pre-codes then would be extremely well, quite well, neither nor, not very well, or not at all well. This other question is, how strongly would you agree or disagree that XX Hospital provides a professional and effective level of patient care? This gives the pre-coded responses very strongly, quite strongly, neither nor, not very strongly, or not at all strongly. That question also could be reworded in several different ways. So give it a think and have some fun with it.